Welcome back to Exam 2 Review. This is Part 3, the last part. Thanks for being patient, and here we go. Now, let's talk about the National Patient Safety Goals. Now, the Joint Commission 2013 National Patient Safety Goals had an objective, and that objective was reporting critical results of tests and diagnostic procedures on a timely basis in a way to improve communication among caregivers. That's very important. Let's talk about some nursing goals. So, if you had a patient who was at risk for falls, what would your goal be for your shift? Or what would your goal be for that patient? Think about that, and these are actual realistic goals. So think about that, and what kind of goal would you write for that? I'm asking you about that because falls are so important in the hospital. Increased cost to the patient, increased stress on the patient. Stay in the hospital becomes longer. So it's important for us to understand falls and how we as nurses can make plans or goals to prevent falls. I want you to look at the older adult and see about how we can assist in prevention of falls and what our interventions would be as a nurse to identify ways to prevent falls or the patient from falling. I'm working on your learning outcome plan strategies to maintain safety in a healthcare setting, home and community, including prevention strategies across the lifespan for thermal injury, fires, falls, seizures, poisoning, suffocation or choking, excessive noise, electrical hazards, firearms, radiation, and bioterrorism. This is on, I'm referencing this back to page 651, and it's also on your blueprint. I spoke earlier in part 2 about seizures. I forgot to tell you guys a little bit more information on it. I just wanted to make sure that I am clear. In addition to the information I spoke about seizures, I want to make sure that you're aware the research has found that more injury can occur to clients if the caregiver tries to place anything in the mouth during a seizure. So they used to do that in the past, not anymore, okay? But we want to make sure loosening any clothing around the neck and chest prevents constriction that might occur during a seizure that could compromise the airway. So we do want to make sure it's not close up on the neck. Break the buttons, whatever we need to do. We want to make sure that airway is okay. And then also remember, people used to do this. We don't do this anymore. Clients should never, never, never be restrained during a seizure, okay? And then we just stay with them. We stay with them and we call for assistance. And we do those things, like I spoke of in part. I'm not going to repeat, but what I spoke of in part 2, and then also in addition to what I just said previously. And then also, if possible, you guys, the client should be turned to the lateral position. We don't put them on their back. We don't put them supine. That's supine. We don't put them flat supine. We try our best to put them in a lateral position, okay? And what that does is allow for any secretions to drain out of their mouth so they don't aspirate. When you guys are reading on restraints, please know this. Please know this. Restraints, they cannot be used for convenience for the care staff. Number 1, cannot be used for that, okay? But if the patient is in a situation where it's going to hinder his or her health status, then restraint will be indicated, and we will notify the doctor and do the proper steps according to the policy and procedure, okay? I think that's what I wanted to talk to you guys on restraints. On your blueprint, I believe it is your last learning outcome, and I'm not 100% sure. I'm going to scroll down, and it is not your last. Yes, it is. It's your last, but it's this outcome here. I want to make sure I focus on here, on this outcome. And you can find where I'm going to speak on this on page 666. I don't have my glasses on, but it's a little blurry to me. But I want to make sure that you guys are aware for our older population, okay? For our older population, I want to make sure that you understand. So when we're having patients, or not even our older populations, let's cut that off. How about just patients, and they're prone to injuries, okay? And you trying to, how can I keep this patient from being so prone to injuries? But that's appropriate for them. Don't forget about buddy system. Okay, those are very important. Buddy system. So a buddy system provides a social contact, right? Safeguards against abuse and offers respite for caregivers. It also provides a way for elders, now we talk about older adults, to be checked on daily. So don't forget about the simple. A lot of times we want to jump to the big time, but we do have the simple and the least. Okay, establishing a buddy system. Well, I hope this helped. And I have no control of when the campuses are closed and the weather and all of that. But it seems like our class is getting hit left and right. So I thought maybe instead of trying to do a review in class to help us catch back up, and not put us even further into a hole, because the review will take a considerable amount of time, you guys can constantly review this. Pause, rewind, look at it again, or I'm sorry, not look, but review it again. I basically try to hit on all of the learning objectives that I have in your blueprint. Some I kind of skipped over and I didn't speak on them because they were basically self-explanatory. I hope this was very helpful for you, and I will try and do this again. I can't guarantee it, but I will try and do it again for exam number 3. And good luck to everyone. And this is the end of the review for exam 2. This is part 3 for exam 2 version 1. Thank you for listening. This is Professor Roberts.